It doesn't need any well-functioning organs to function. If you deliver insulin, insulin brings down blood sugar. So it looks like a very good medication to be on, but why is it then that a lot of people are not on insulin, and a lot of people fear being on insulin, and insulin is kept to the, sometimes even the last medication to be used? Pure and simply because insulin has to be injected into the body, and at present insulin is not available in any oral forms that you can use. So people with type 1 diabetes that you heard of earlier, where the pancreas is gone, they don't have insulin in the body, these people definitely have no choice. They need insulin for survival and for control of their diabetes. In type 2 diabetes, generally we keep insulin at a later stage when the oral medication does not work, and sometimes that can come about with long-standing diabetes if a person has diabetes for about 10 years or more. Sometimes the doctor may ask you to go on insulin temporarily, and again this shouldn't be feared, because there are certain situations where insulin is necessary for a temporary period of time, just before surgery for better control of diabetes, if you're ill in the hospital for another condition, during pregnancy. Now why would you use insulin in pregnancy? Purely because it is the safest that you can use. None of the oral drugs are as safe as insulin, and so that attests to its safety. And sometimes if you're on other medication that raise the blood sugar, like steroids, then also the doctor may temporarily put you on insulin. How is insulin used? If you look at the two graphs here, this is how the sugar goes up and down before and after meal, and the body produces insulin to control the blood sugar excursions. And so when we give insulin, it is also to mimic the body's production of insulin. And so if these are the sugar excursions that you see, one way to give insulin is the long-acting insulins, and you know them as insulatard here in green, or Humulin N, or as the long-acting proportion in the pre-mixed insulins. But you see that these are not perfect. They do not cover the spikes of sugars after meal. And so the long-acting insulins usually have to be combined with the short-acting insulins, what we call AgRapid or Humulin R, or the other component of the premixed insulins. The comparison in terms of time, the regular short-acting insulins have to be given about 20-30 minutes before each meal. They peak about 2 to 4 hours and they're gone after that. The long-acting insulins stay in the body for about 12 to 24 hours, and they don't have a large peak like the short-acting insulins. We also call them the short-acting insulins and the long-acting insulins. Now, all the developments in insulin is actually to make things simpler for you so that you get a better result from the insulin. And this is where the newer insulins, what we call the designer insulins or the insulin analogs, come in. And you may recognize some of these names. These are the medical names: insulin aspart, insulin glulisine, and insulin lispro, better known as Novorapid, Epidra, and Gluhumalog. So these are rapid-acting insulins. Then we have also the designer insulins, which are long-acting. The medical terms are glargine and ditamir. And the insulins that you know or hear about are the Lantus insulin and Levemir insulin. How do they compare with the older insulins? The rapid-acting insulins act faster, and the long-acting insulins act for a longer period of time. So if we just talk about the rapid-acting insulins compared with the short-acting insulins, you can see the difference here. The rapid-acting insulins are called Humalog, Novorapid, and Epidra. They are more like what the body produces. They work very rapidly, and they have a very fast and short onset of action. Because of that, they can bring down your post-meal sugars, and there's less hypoglycemia in between the meals. These are the regular insulins, the AgRapid or Humulin R, and these are the shorter-acting insulins. What does it mean to you? It is more convenient because you can give it immediately before, during, or immediately after a meal. There's better blood sugar control, and it avoids the low sugar in between meals. Similarly, for the long-acting insulins, these are the old NPH insulins, Insulatard Humulin N. This is the newer insulin analog, which can be given once a day and is flatter. What it means again to you is that it's a safer insulin to use and it's more convenient because you just need to give it once a day. So after all this, I've told you about oral medications and insulin. What is the medicine that is best for you, best for me if the person has diabetes? In the end, it is a discussion between you and the doctor. You remember that it has to target all the things that go wrong with diabetes, And in the end, it has to be combined with a lifestyle that is good in terms of diet control, exercise, and weight control. So discuss it with your doctor and don't avoid or ignore insulin if the doctor suggests it, because as I said, it's about the safest medication that we have. It can be used for women in pregnancy, and the only reason why it's not used earlier in diabetes is because it's an injectable, and a lot of people don't want to go on it because of convenience. So with that, I hope to have cleared some of the doubts that you may have about some of the medications you are on. And later on, during the period of questions, we can take any questions that you may have. Thank you very much.
Thank you very much, Dr. Kevin Tan.